Well, there's a lot of differences. I think, in terms of technique now, I mean, a lot of if you look at even the doctors that are sort of following the formulaic package insert on the Allergan thing, it would have you injecting here up above her eyebrow. And what that does is it drops the middle part of the eyebrow down. It weakens too much of the muscle that lifts the eyebrow. And they do get an arch, but it's a funny sort of evil-looking arch. It doesn't look good.
Oh, I don't want that.
And we've seen that. I just was commenting on one of the television shows recently on a couple of the actresses on Desperate Housewives have that look where the eyebrow is down in the middle and swinging up on the side. It's arched, but it looks like you're evil. I don't understand why and they've obviously had Botox. So this is all about strategies to just relax the muscle that pulls the eyebrow together so we don't get these vertical lines and we don't make that angry frown.
Now this story we're doing today, minimally invasive medical spas, very timely because medical spas are popping up, it seems, on every corner. And there's a lot of things that people need to know, I guess, to be careful of. And so today we wanted to visit a real medical spa. So what defines a real medical spa, and what should people look for?
Go to the Injectable Safety Coalition, and the injectablesafetycoalition.org, injectablesafetycoalition.org, is a good source for looking at what people should be seeking when they're going to get these treatments. A lot of people think of these injectables and some of these lasers as something that you can just, go do a weekend course and then you're suddenly qualified to do a good treatment, and that's actually not true. I mean, this is, as you've seen today, a very specific artistic type of endeavor that people need a lot of training for. We have specific criteria for training all of our providers here. They go through really regimented protocols and training. They adopt my philosophy in terms of the aesthetics. We have weekly meetings and go over sort of patient strategies. And to really go to a medical spa that's working, I think it has to be integrated to be really good. It has to be integrated with a doctor's office, and a doctor not only that's committed to the practice of aesthetic medicine.
So like a plastic surgeon, facial plastic surgeon?
Plastic, facial, plastic, derm. And listen, I have colleagues out there that that haven't trained in some of the core specialties, plastic, facial, plastic, derm, but they're committed to learning it and they're committed to their practices. And I don't really, some of my colleagues would disagree with me on this. I don't have any objection to those people who are committed to learning and doing the aesthetics and are committed to their patients. Everyone on the staff at the Appearance Care Center has these specific strategies in mind. I've written a number of book chapters and published them and for the academic literature. So it's out there, but people aren't a lot of people don't read. They need to study. Raise your brow way up for me, Jen, and then relax. So just a very light dose across your brow is really all we need to do. Tiny little series of stings here. Ooh, pinch.
Okay, yeah, that doesn't really hurt at all.
Good, and it shouldn't. And she did it without numbing, and I'm just going to do a couple more drops up high so she doesn't have any lines up there. Raise your brow once more. She's got a little bit of asymmetry, just a little bit line on the left side that she does. Raise your brow up. She makes a little.
Why is that cup?
It's
everyone's different?
Everybody's a little different, little anatomic difference. So if I don't address that, you'd notice it. So I'm going to put a little drop there to make sure you don't have that.
Okay.
And then raise your brow once more, and relax, and one more little tiny drop right here, and then we're all done.
Thank you.
So Jen's treatment took us 3 minutes. She elected to not do it with numbing. A lot of patients do a little topical numbing medicine on there. And she'll look good, and she looks great now. She didn't look like she had a treatment. But she'll be wrinkle-free in about 2 or 3 days. 3 days at least onset of action, and sort of peak effect at about 5.
Good.
Now you believe now, we've talked a lot off camera, that you could almost slow or stop in some ways the aging process, the appearance of aging with technology, with some of the new procedures. Do you feel that way?
Absolutely no question. We can take somebody right now that's 40 years old, and 10 years from now they can look like they're 40 years old. And so we don't have to try to make somebody that's 40 look like they're 20. Okay. We can keep them looking good throughout that whole decade with little procedures. They're coming in 2-3 times a year tops. Little procedures, very little downtime for most of these things, if downtime at all. and really maintain that very vibrant, attractive, youthful appearance.
So I'm a mother of 2 fabulous little boys, and I work here at the Appearance Care Center at the Maas Clinic. I think, first of all, I think anybody who's had, any mother out there who's had children and has lost their baby weight, because I think what happens so often is you lose your baby weight and you're thin again. You can fit in your clothes, but when the clothes are showing a little too much, when that shirt rises up above the belt and that skin is there, surgery isn't going to take care of that, or you don't want to go through an expensive surgery for something like that, and you think exercise will help. All the sit-ups in the world don't. This machine tightens it right up. I was one of the first patients to try VelaShape. I had some skepticism about how can I take this body that had 2 little boys, 2 big boys, 2 big babies, and the skin's not exactly the way it used to look. I thought there's no way a machine that has minimal downtime and no pain is going to decrease the circumference, so kind of make you look like you are a little smaller. I had about 4 treatments, about 15 minutes, 15, 20 minutes each time. No pain, just a little kind of tingling sensation, a little red. And I have to say those jeans even feel a little looser because, again, like I said earlier, you lose a little, feels like you're losing a little weight. Maybe you want to fit into that little black dress for a holiday party. It's a good idea. But I think just in general, I mean, for the legs, for the arms, any part of your body that you're feeling is just a little loose and you're working out, you're drinking water, you're doing everything possible to be in shape, and you just can't get rid of that maybe extra dimpling or extra, in my case, skin, this really helps. I am now looking fabulous in a bathing suit.